old retired teacher is admitted to AE with a department with a fall and hip pain. He is normally fit and well. He lives with his son in detached two-story house. That means he is able to do any type of the work. A hip X-ray review that the subtrochanteric fracture. What is the best course of the action? That means here the diagnosis. Here, keep in mind here the diagnosis is confirmed. So we have to go for the treatment. But if the X-ray fail to diagnose the fracture area, then in this condition we should go for other investigation. And as the diagnosis is confirmed, so we can go to the treatment option. Here the options are the insertion of intramedullary nail, total hip replacement, uncemented hemiarthroplasty, percutaneous pinning, and hip arthrodesis. So first of all, let's see the different type of the femur fracture. The most common is the intracapsular femoral neck fracture. Then here we can see the intertrochanteric fracture and subtrochanteric fracture. And in our patient, this is this area. This is the subtrochanteric fracture. That means this line is the trochanteric line or trochanteric area. So below this line is the subtrochanteric area, and any fracture in this region is known as the subtrochanteric fracture of the femur. So here we can see this is the subtrochanteric fracture of the femur, and in case of subtrochanteric fracture, there is a good option which is the IM nail or intramedullary nail. So the intramedullary nail is the best option for the subtrochanteric fracture. And other fractures such as the partrochanteric or peritrochanteric fracture. In case of partrochanteric or peritrochanteric fracture, most of them are done by the dynamic hip screw. Dynamic hip screw here the best option for the treatment of the peritrochanteric or intertrochanteric fracture. But when there is the fracture is very unstable, there is reverse oblique. In this condition, there is the intramedullary nail insertion. In case of unstable, in case of reverse oblique, it is the intramedullary. But in case of subtrochanteric, there is no other option. Direct go for the intramedullary nail. So in case of peritrochanteric, we should keep in mind it is the dynamic hip screw, and in case of subtrochanteric, it is the intramedullary nail. And in peritrochanteric, some of the fracture may treat it with the intramedullary nail, but most of them are by the dynamic hip screw. And the another one which is the neck fracture of the femur. In neck of femur fracture, in this condition, two option. One is the hemiarthroplasty, another one is the total hip replacement. So hemiarthroplasty and total hip replacement, they are the option for neck of the femur fracture. But in case of stable patient, actually total hip replacement is done. And in case of the disabled patient or bed-like patient or the patient who is very weak, in this condition hemiarthroplasty done. So in this, as it is the subtrochanteric fracture, what is the option? Direct answer, it is the intramedullary nail. Other options such as the total hip replacement and uncemented hemiarthroplasty, they are usually done in case of the neck of the femur fracture. Percutaneous pinning is not possible because the fracture is so deep that the pinning is not possible, and the hip arthrodesis also not possible. So the best option is intramedullary nail insertion in case of the subtrochanteric fracture. And in case of the peritrochanteric or intertrochanteric fracture, the best option is the dynamic hip screw. And when there is the femoral neck fracture, we should go for the total hip replacement in case of young adult, and in case of immobilized or disabled patient, go for the hemiarthroplasty. Thank you all.